My name is Saul Schaefer. I'm a professor of internal medicine and cardiovascular disease at the University of California, Davis, and I'm speaking to you from Vancouver in July 2013. I just gave a brief summary of the use and indications for alternative and complementary medicine in cardiovascular disease. This is an important area because we spend over $50 billion a year on these interventions, and we don't have any good outcome data that indicates usefulness in cardiovascular disease. The general message is that there is a wealth of epidemiologic data showing that populations that have high levels of omega-3 fatty acids, have high levels of vitamin D, have high levels of other vitamins, have actually lower incidence of cardiovascular disease. The issue is that intervention trials that have looked at these therapies have failed to show any significant reduction in cardiovascular disease. I reviewed the data on omega-3 fatty acids since our diets have changed from a ratio of 6:1 omega-6 to omega-3 fatty acids to a current 25:1 omega-6 to omega-3, which is a pro-inflammatory diet. The data for omega-3 fatty acids overall shows approximately 4% risk reduction for cardiovascular events. And the Mediterranean diet, which is high in omega-3 fatty acids, also in the New England Journal PREDIMED study showed a reduction in cardiovascular events that was driven primarily by stroke and primarily by a reduction in hypertension. I also reviewed the data on vitamins, showing that vitamin C may have some beneficial effect, vitamin E does not in randomized controlled trials, and vitamin D has sort of a sweet spot where low levels of vitamin D below 20 nanograms per deciliter increases risk, and increasing supplementation with vitamin D can increase cardiovascular risk with exogenous supplementation. Then finally, I looked at the TACT trial, which looked at chelation therapy to reduce calcium in patients with known cardiovascular disease compared to placebo. This is important because over 100,000 patients use chelation therapy per year, and we don't have any outcome data that's robust. This trial, the TACT trial, was published in the New England Journal of Medicine and demonstrated a statistically significant reduction in cardiovascular events. However, there was a significant dropout rate. Only 65% of chelation patients actually completed the trial, and there was a large dropout rate in the control group. So while this trial was published in the New England Journal, it is really more hypothesis generating. So at current time, it's important to advise patients to use hygienic measures to reduce cardiovascular risk. That is, increase exercise to 5 days per week of breathlessness, have a diet that's low in saturated fats, high in fruits and vegetables, and take medications that are prescribed by the physicians without any evidence that alternative medications actually improve outcomes.